On today's episode of the Forgiven Nutritionist podcast, I had the pleasure to talk with Christina O'Connor and Jennifer McManus all about the gut. They are both registered dietitians and work with Pendulum Therapeutics, so they know the gut. That's the company where I get my probiotics from. We talk about what the gut is, what we can do to help it, and even heal it. We also talk about poop and even some of the symptoms that the gut can show when something is off. Maybe the diagnosis you have been given can be helped by simply fixing your gut health. Here's a clip from today's episode.
So some of the other diseases that might be, not as familiarly tied to the microbiome are a lot of cognitive issues. So Alzheimer's, Parkinson's, dementia, anxiety and depression. We do know there's a strong link between the gut and the brain. The microbiome might be a good place to start to really look into these neurocognitive diseases.
Pendulum has probiotics that will help heal your gut. Their lineup includes Akkermansia, Metabolic Daily, and one called Glucose Control, which is great for anyone wanting to improve their blood sugar levels, and you don't have to be a diabetic to take it. Any of these three probiotics include an important strain of probiotic called Akkermansia, which is only sold by Pendulum and is a key component of strengthening your gut lining and gut health. All of their products are clinically studied and third-party tested for quality. Check out all of their products at pendulumlife.com/discount/forgiven or click the link in the show notes. Use code FORGIVEN for 20% off your first month membership. Welcome, Christina and Jen. Why don't you guys each tell us a little bit about yourself and a little bit about your background?
Sure. I'll go first. I'm Christina O'Connor. I am a registered dietitian by trade. I've spent most of my time in pediatrics, specifically in the NICU. It's where I fell in love with the microbiome. More recently, I have stayed home to spend time with my two young boys. And just coming back into the workforce at Pendulum. So really exciting to be on the cutting edge of the microbiome and probiotics.
Awesome. Thank you. My name is Jen McManus. I'm also a registered dietitian and certified diabetes care and education specialist. Before starting Pendulum about 2.5 years ago, I did work in a large hospital setting doing a lot of heart health, diabetes, patient education, and then also I did spend some time in an intensive care unit, but I really did miss talking to people, so I decided to make a transition over to Pendulum, and I've had a really unique experience here because I got to actually be on two different sides of the business. I got to really work with our customers or with the people that are taking our products, and then recently made the transition over to the healthcare side of the business where I serve as a healthcare growth manager to really bring awareness of our products, the microbiome, and our novel anaerobic strains to healthcare providers.
Great, thank you. That's kind of especially why I wanted to have you guys on, because I've seen some of your webinars that you guys have done. And so why don't you give me kind of the microbiome 101 version and what it actually is. So that way, just in case some of my listeners aren't familiar with what it is or why it's important, that kind of helps give them a little background.
Sure. So I'll take that one. So the microbiome, you can consider to be almost like an organ as part of the human body. So it's a symbiotic relationship between trillions of organisms and us. So we're kind of the host, hosting bacteria and viruses and fungi. And they are not all bad. Actually, most of them are really good for us and really beneficial. So we can't actually live without them. And they help us with lots of different things, like helping us to digest our food. They produce vitamins and minerals that are missing from our diet. They help to break down toxins. They protect us from disease by crowding out pathogenic organisms. They also educate our immune system. And so there's really no part of our biology that's not touched by the microbiome and the organisms that are living in us and on us.
I think something that's kind of new for maybe a lot of people to understand too is that people just think of our microbiome as being in our gut, which it is, and that's where we have a lot of good and bad bacteria, but a lot of people aren't familiar with, too. We have a microbiome that lives on our skin and in our nasal cavity and in our mouth and basically everywhere.
Yes, everywhere.
Yes.
In our lungs, too. That's another one that I always forget about.
Oh, definitely. Yes.
In our lungs.
Yes. So how do we even get our microbiome in the first place? I mean, I'm sure that we're born with our microbiome, but how do we get it to flourish and grow?
Yeah, so that's something that I really learned during my time in the NICU. So your first introduction to the microbiome that you're going to start with and that will likely carry you through life is from your mom. And actually, Pendulum just did an article for Mother's Day on how your mom influences your microbiome. So it's really important for moms that are thinking about pregnancy or moms that are pregnant to make sure that their microbiome is healthy, because you are, in a sense, passing that on to your infant. So if you're born vaginally, you are inoculated with bacteria in the birth canal, which is really beneficial. If you're born C-section, then your first experience into the world of bacteria is more of a sterile one. So that's a little bit of a negative hit to the microbiome. Skin-to-skin contact, so just holding your baby, you get part of your microbiome from your mom that way. And then breast milk, just a little bit of breast milk is so beneficial for babies and just for keeping their guts healthy and introducing some of the beneficial bacteria. And then also breast milk has the food and the prebiotics in it already that those beneficial bacteria need to thrive and grow and flourish. So yeah, it really starts the moment that you're born.
Yeah, and that's something that I never thought about when I had either of my kids, especially 20 plus years ago. And I'm a little sad that I wish I would have known that then, what I know now, because I know that for one example, one of my daughters has some eczema and psoriasis. So I know that definitely would have helped her and would have helped her struggles all these years with some of that right away. So I definitely wish I would have known about some of that, but at least we can know that now going forward. And I know that a lot of times some of the issues can be repaired or reversed or even fixed a lot to help reduce a lot of the symptoms.
Yeah, absolutely. And I did all those things. I was married to a vaginal birth. I was married to breast milk and no formula. And my 10-year-old still has eczema and asthma. So you can do all the things. And sometimes, genetics just happens.
Yeah, definitely.
That's a good point. I give my mom, some flack because she's going to kill me, but she only breastfed me for 2 weeks. But I feel like the research back then just wasn't the same. So I think, to those who might be listening that did, 20 years ago have, a different agenda or, different education, they didn't know as much back then. So give yourself some grace and your kids are still perfect. Yeah.
Isn't that the truth? Yes, definitely. Definitely. And now I'm here to help people. So that's okay. I had a different purpose. So, what are some good signs of a healthy gut? If people are wondering now, okay, well, is my gut healthy? How do I know? Because, it's not like a cut on the arm where we can see that. It's not like a runny nose where we can see and experience that. But what kind of things do people go through if they don't have a healthy gut?
Yeah, so that's a great question. Some signs of a healthy gut are really the absence of, some issues or problems that can manifest themselves on the skin. Like we were just talking about eczema. Eczema, I'm sure Wendy, a lot of kiddos that have eczema as babies grow up to have asthma. That's also a sign of the gut not being healthy. Gut symptoms, I think that's probably a pretty obvious one. So diarrhea, constipation. Jen's going to talk a little bit more about healthy poops and what that looks like. But so like a healthy gut is really the absence of health conditions or symptoms. When there's inflammation in the body, that's a pretty good indicator that there are issues in the gut as well.
Yeah, from a stool standpoint, I could talk about poop all day, every day. If you're familiar with the Bristol stool chart, it's a scale that's on a scale from 1 to 7. So type 1 through type 7, with type 1 being, small, hard. I like to call them, rabbit pellets. That can kind of, maybe tend to be more on the constipated side. That could be a sign of an unhealthy gut. Whereas type 7 is more on the runny or diarrhea side, where it's, just liquid stool. We really want somewhere in between. So we really want to shoot for that type 3, type 4 formed, regular bowel movements. That's a really, really good telling sign of a healthy gut.
And I'll try to put a link to the Bristol stool chart in the show notes, so that way people can kind of get a visual too, so they can examine for themselves and see, what does theirs look on an average day. And hopefully they'll kind of that's their first little clue that maybe something is going on, if they don't have a skin issue or something like that already that's a little more visible.
And tacking on to the stool, abdominal pain, gas, bloating, if those are normal signs of, a high fiber diet, you might feel some gas or bloating. But if it becomes significantly uncomfortable, that could also be a sign that there might be something deeper going on with your gut health.
Hey everyone, just a quick break to show some gratitude to our sponsors and give you some special deals. Pendulum has probiotics that help heal your gut. They have one specifically designed to help if you suffer from gas and bloating. It's called Butyricum. Butyricum contains a targeted probiotic strain that can naturally be found in the gut microbiome. It has been shown to target multiple pathways in the gut that are linked to GI symptoms. All of their products are clinically studied and third-party tested for quality. Check out all of their products at pendulumlife.com/discount/forgiven, or click the link in the show notes. Use code FORGIVEN for 20% off your first month membership. Yeah, I'm glad you said that too, because I know a lot of people that do have gas and bloating. And I know some people too, like if I don't eat something, especially with the change in seasons, your body's used to eating certain things for a couple months, and then you get a new season where you're visiting the farmer's market and you're getting more fruits and vegetables that you haven't had in a couple months. That can definitely change as well. And like you said, that's normal and that's expected and that's good. So people shouldn't always panic right away when something like that happens. So what are some key signs and symptoms maybe that your gut needs help that are kind of some of the bigger ones? I know that we talked about the skin, but what are some bigger issues that maybe people don't necessarily associate with the gut?
Yeah, so metabolic disease is something that really people don't associate with our gut health or our overall microbiome. So if you're not familiar, metabolic diseases really refer to this broad category of disorders that really disrupt our normal metabolism. So it's in our metabolism, is, if you think of it as the process by which our bodies convert food into energy. So these diseases often involve abnormalities in how our body processes and utilizes nutrients. So these metabolic diseases can affect various organs and systems in the body, including our liver, our pancreas, our thyroid, and our gut, and of course, the adipose tissue and how much of it is present. So some common examples of metabolic diseases that you probably are very familiar with are diabetes. So both type 1 and type 2 diabetes are metabolic disorders characterized by high blood sugar levels. Obesity is a condition characterized by excess body weight, which is primarily caused by an imbalance between calorie intake and energy expenditure. Metabolic syndrome. So metabolic syndrome is really a cluster of conditions, including abdominal obesity, so really that fat mass gain around your abdomen, high blood pressure, high blood sugar levels, and then abnormal lipid levels. And metabolic syndrome increases your risk of developing cardiovascular disease, stroke, and type 2 diabetes. And then the last metabolic disease that you might not be as familiar with is non-alcoholic fatty liver disease. So this is a condition characterized by the accumulation of fat in the liver cells. So this is also associated with obesity, insulin resistance, and metabolic syndrome. So these metabolic diseases have been closely linked to the microbiome because the bugs in your gut really play a crucial role in maintaining our overall health, and they play that role in the metabolic processes. So they really help with inflammation. They regulate our appetite. So they tell us, when we're feeling full. They regulate our immune system, as Christina mentioned earlier, and they really are involved with, harvesting that energy and breaking down the nutrients to produce short chain fatty acids and different byproducts there as well. So some of the other diseases that might be, not as familiarly tied to the microbiome are a lot of cognitive issues. So Alzheimer's, Parkinson's, dementia, anxiety, and depression. We do know there's a strong link between the gut and the brain. The microbiome might be a good place to start to really look into these neurocognitive diseases. And there's also a lot of research coming out about cancer, and how that could also be stemmed from the microbiome. There's some really cool research about, if you get rid of some of the dysbiosis that might be associated with cancer and, the chemotherapy and the radiation that might be caused from these treatments, that might actually help improve the outcomes of the cancer.
I mean, I know personally several people that have non-alcoholic fatty liver, and unfortunately, they're not my clients. But I would love to get my hands on them and have them assist them with cleaning up some of their gut microbiome, because I think that alone would definitely start to maybe make a big change in their lives as far as the health of their liver and everything goes. And your liver is responsible for so many processes in the body that sometimes people just don't understand the importance of it, especially for detoxifying anything. So it's if you don't have a healthy liver and you're having an unhealthy gut, it's not going to assist you with feeling better, and it's only going to make things worse and progressively with other things in your body as well. And the system's going to get worse and worse.
The other one that I always love to highlight is ALS. So Lou Gehrig's disease. There's a lot of research out about how the microbiome is connected and how certain species might be missing in those individuals with ALS. So super passionate, just such an awful, awful disease that I really hope we can eventually, hopefully in our lifetime, figure out how to completely prevent.
So what affects the microbiome both positively or negatively? I think that might help people kind of get a good start as to figuring out, okay, what am I doing? What am I eating? Where am I, what environment should I not be hanging out in? What kind of things kind of play a role on the microbiome?
Sure. So I'll start with the negative impacts first, get those out of the way. So the things that we know, of course, antibiotics. So if they're unfortunately, they don't discriminate. They kill everything, the good and the bad. But also pharmaceuticals. A lot of pharmaceutical drugs negatively impact our microbiome, our stress levels. We were just reading a study a couple weeks ago talking about emulsifiers in nut milks and how that negatively impacts Akkermansia, which happens to be one of our strains. So there are a lot of factors that negatively impact your microbiome, just your overall health and well-being, your sleep hygiene, your exercise routine, and certainly your diet. So the things that you're consuming. Are you consuming a lot of fruits and vegetables? Because those are the things that, the good organisms in your microbiome feed off of. It's interesting because when there's a state of dysbiosis, the bad organisms in our microbiome, they really crave and feed off of, they make us crave carbohydrates and sugars because that's what they feed off of. So they really are driving our food choices. So I think a lot of times when people say, well, I just don't have the willpower, to make those healthy food choices, sometimes it might not be your fault. It might be the organisms in your microbiome driving those food choices. And so when you balance those out and get some beneficial organisms in there, they actually prefer fruits and vegetables. And people will report actually enjoying their salads for a change. I really wanted to eat that salad. I wasn't forcing myself. So certainly your diet will impact your microbiome in a healthy way. and just taking care of yourself and, having healthy habits, getting plenty of exercise, taking probiotics. So if you're actually missing strains, nowadays you can take a probiotic and replenish that organism, which is especially beneficial after you've maybe taken a course of antibiotic. So, and more companies such as Pendulum are coming out with strains that are a little bit more novel and have really specific health benefits when it comes to the microbiome.
I definitely think that's a new concept for people to understand. And I think probably for doctors as well, because I didn't understand until recently when I had in some of my schooling where we learned that there are different strains. For example, just with bifidobacterium, there's a lot of different strains that can really target and work well for certain conditions, whereas others work better for other conditions. So I think that's kind of an interesting new concept. And obviously there's a lot more to be discovered, I'm sure. But it's good to know that there are companies out there who are working to target specific strains for specific things rather than just getting any old probiotic. And maybe that's a good thing that people kind of ask questions. Okay, I've got some of these symptoms. What kind of probiotics should I take or should I go for? Because I don't want to just take probiotics just to take them. You really want to work to heal and replenish your gut.
Yeah, I think that's where we're headed too with the microbiome science, Jen. I don't know if you would agree, but I think that we're getting to a place now where it's, just take an antibiotic after you're finished with your antibiotic. I think now we can really target health conditions and look for strains that are missing in certain conditions, and really heal our microbiome and ourselves in that way.
Yeah, I completely agree. And Wendy, I think you said something that really kind of struck home to me is I feel like, working with your healthcare provider to learn which strains specifically would benefit your symptoms or your disease, or if you have a family history of diabetes, which strains can I take to really help delay or prevent the onset of diabetes? But really taking charge of your health. I was watching this video yesterday and someone said, be the CEO of your own health. But really, working with your healthcare provider to figure out which specific strains are going to be the best for you.
Yeah, definitely. I agree. And since you brought up Akkermansia, I know that a lot of people, like Dr. Hyman and several others, love Akkermansia. I myself have taken Akkermansia as well, and I know that it's in several of the Pendulum products. But tell us a little bit about what Akkermansia is good for.
Sure. So Akkermansia is a really interesting organism. So its full name is Akkermansia muciniphila. So it is a mucin-loving organism. It's a strict anaerobe, so it cannot be in the presence of oxygen. It lives in our colon. And in your colon, you have a mucus layer that's living on top of your epithelial cells. So Akkermansia's job is it's mucin loving again. So its job is to degrade and sort of slough off and actually eat the existing mucin that is old and needs to go away. And what that does is it actually stimulates your goblet cells to produce a fresh layer of mucus. So a nice, fresh, thick layer of mucus is what's needed to prevent gut permeability. So when your gut is permeable, it allows opportunistic and pathogenic organisms to end up in places where they shouldn't be. And that causes inflammation, which can manifest in a number of ways. So Akkermansia is really a keystone commensal organism that's critical to the microbiome ecosystem. One of our providers actually compared it to the wolf in Yellowstone. For many years we thought, oh, the wolf is bad, we have to get the wolf out, just kill the wolf and everything will be better. So that's what we did. We killed the wolf, and then the whole ecosystem of Yellowstone collapsed, from the bugs to the trees to everything living there just wasn't flourishing anymore. And it was because of that critical piece of the ecosystem that was missing. So they reintroduced the wolf, and lo and behold, Yellowstone return to its greatness. And so you can think of akkermansia as kind of like that. When it's missing, it provides key functions and really is so helpful in maintaining your gut integrity and reducing permeability and inflammation in the body.
I think that's maybe something that a lot of people don't understand too, is because my next question to you is going to be, what is leaky gut and why should people care? And I think one thing they don't understand is that, they went to their GI doc, they got a colonoscopy, they got all the testing done, and the doc said, it's fine, I don't see anything. And I think people, when they think of leaky gut or they hear that they have holes in their gut, they're literally picturing a hole instead of this membrane that's really thin and, it's like a cell thick, and they're literally expecting a hole, but instead it's just thin enough where something is supposed to get through. It's cells and membranes and things like that. You're not going to be able to see an actual hole. So I think that's a little new and mind-blowing for some people as well. So what kind of is leaky gut? Since you mentioned akkermansia kind of helps keep our gut intact and helps keep it together.
Yeah. And honestly, when I first heard leaky gut, I laughed it off. I thought that there's just no way that our gut is permeable, or, that our body would be compromised in such a way that our gut would be leaky and things would end up in places where it shouldn't be. But it's actually very true. And it's actually a real condition that we're finding out more and more about. I started reading, I read a couple of books I'll mention by Natasha Campbell McBride. I don't know if you've ever read any of her books, but she wrote some really interesting just about a leaky gut and how to heal your gut through certain foods like fermented foods and bone broths and things like that. To promote those beneficial bacteria that are really working to strengthen that gut barrier. So yeah, leaky gut is just when the gut barrier is not strong and it's not functioning properly. And like I mentioned, those opportunistic and pathogenic bacteria, they get into places where they're not supposed to be. And so then the body has to respond, and it usually responds with inflammation, which can manifest itself in a number of ways. In one person, it can look like cancer, and another person, it can look like metabolic disease. So here at Pendulum, we're hearing from a lot of different providers that are using our strains, using akkermansia for a host of different health reasons, because leaky gut really does touch everything. Having a good functioning gut lining is critical to all health.
Definitely. And I know that I had previously suffered with depression and anxiety. And so that was one of the things that you had mentioned before, Jen, too. And so that was one of the first things that I noticed was when I started taking probiotics, and I started, I did start changing my diet as well. I didn't just do the probiotics and vitamins, but that was one of the first things I think that started healing on myself was my gut. And that's when I really started to notice a big change. And so I don't know if I had leaky gut, but I'm like 99.9% sure I did at that time because of all the other symptoms and things that I was having as well. But it definitely can make a big impact on you when you change something like that.
That's such a good point, Wendy. The gut-brain axis is actually a bi-directional relationship. And I had a very similar situation in college. It's obviously a very stressful time and you're not taking the best care of your gut. But I was having a lot of IBS related symptoms, and they couldn't, same thing, did the colonoscopy, did the, entire ins and outs endoscopy. And they said, everything's fine. And as soon as I got my anxiety under control, a lot of my IBS related symptoms went away. So yeah. I think you kind of shared the opposite scenario, but it's so true that this gut brain connection is there, and getting your gut and your brain in check is going to be really, really beneficial.
Yep. And since we were talking about the whole depression and anxiety thing, and you had anxiety, things that people don't realize is like 80 or 90% of serotonin is made in the gut. And so, it plays a huge factor. Yes, there's some in the brain as well, but the gut definitely plays plays a factor in a lot of things, especially depression and anxiety. So if somebody has a leaky gut, what are some of the things that they can do? I know you guys mentioned probiotics. That's a good start. And one of the things I try to recommend to clients is don't just take a probiotic if you're not going to change anything else. And I was just listening to another doctor. They say the same thing. It's like you can't out supplement yourself out of a bad diet or a bad lifestyle or a healthy environment. So what are some of the things that people can do to kind of help repair their gut, whether it's a leaky gut or they just have some gut issues that they need to rectify?
Yeah, absolutely. I think about this with my kiddos after taking antibiotics. They can't swallow a probiotic pill. So I was searching for ways to, heal their guts and restore their microbiome. Fermented foods is a really great way to do that. Yogurts, kefir, sauerkraut, kimchi, all of those things can really help repopulate the microbiome with beneficial bacteria and heal your gut. Things like bone broths, and they have lots of collagen, and those are also incredibly healing for the gut as well. So just eating an overall healthy diet, lots of fruits and vegetables, and feeding those maybe what little good bacteria you do have. Feeding them, what they need to grow and flourish and colonize is really going to help them to stick around and hopefully do some repair.
Yeah, and to add to that, as a dietitian, I feel like our front runner is always to talk about food. So really focusing on all those things that Christina mentioned, but to nourish the bugs that might still be present there, even with the after antibiotic. Really focusing on those high fiber foods. So soluble fiber is going to be really beneficial. Jerusalem artichokes, prebiotic foods, garlic, asparagus, all really great ways to help feed those gut bugs that are present. And then polyphenols as well. So grapeseed, pomegranate, cranberry. Some of my favorite polyphenol containing foods are green tea, red wine, and dark chocolate. So pretty easy to get your polyphenols. Coffee as well, if you're a coffee drinker, those also contain polyphenols. So there's just many things that you can do to improve your microbiome besides food as well. Don't discount your lifestyle. Exercise, that's going to be really beneficial to improve your overall gut health. Sleep. Sleep can really impact your microbiome. So something that I've noticed working with customers is stress. You can do everything right. You can have the best diet. You can have the best supplement regimen, the best doctors, and you can be really active. But if your stress levels are just not manageable, that's not going to help your microbiome at all.
Yeah, definitely. And I think that's something that people kind of don't think about on a regular basis, especially when, they get an angry text and, they vent about it for 20 or 30 minutes. People don't realize that, and I forget this myself, but for that 20 or 30 minutes, you can elevate your blood sugar and you can keep some of those problems going. And it does impact your gut, especially for that 20 or 30 minutes and then sometimes beyond. And we don't always think about things like that. Yes, maybe we weren't in a car accident today or we didn't lose our job, but someone just irritates us for one reason or another, or we keep rehashing something. It can be those little bits that over time do get worse and worse and worse.
Absolutely. You're stressed about your stress.
Yes. And I know that before you had mentioned prebiotics. What are some good prebiotics? I know you mentioned fiber as well. So maybe people don't realize that the prebiotics kind of feed the probiotics. And the probiotics need to eat something too to keep them going.
Yeah, exactly. There's some really great prebiotic supplements out there. A really popular one specifically for gut health is chicory root or inulin. But of course, as a dietitian, I encourage people to get their prebiotics through whole food sources first. One of my favorites to recommend is green bananas. So, you'll notice there's just a completely different composition of that banana if it's green or greener than if you have a banana that has a bunch of brown spots on it. My husband knows, like, don't even give me that brown banana. That is just not going to fly. But green bananas are a really good one. Jerusalem artichoke, as I mentioned, onions, leeks, artichokes, garlic, which is another easy one that you can always throw into your food. Great prebiotics. Oats. I'm trying to think of what I'm forgetting. Apples, on the skin on the apples. Have really good probiotic. I know growing up, my mom used to cut the skin off of every fruit that we used to eat. And I'm like, no, Mom, like, no, looking back on it now, like, and all that good stuff is. So making sure you're eating the skin as often as possible. And with your potatoes, sweet potatoes, regular potatoes, that's where all that good fiber is going to be.
Right. And I know that recently I read a study on PubMed about the effects of prebiotics with insulin and even some lipid levels. And I think I'll put a link to that in the show notes as well, how it can really promote the growth of beneficial bacteria, prebiotics. So I think people kind of discount eating the fruits and vegetables, or helping to take a probiotic as well, along with the fruits and vegetables. If you have high insulin, or have some lipid level issues, those are some of the things that are a concern for you. I think it's one of the low-hanging fruit that sometimes people can overlook and can help boost that back up again.
Absolutely. That's a good call out.
So what effects does the microbiome have on the immune system?
Ooh, great question. I know you talked a lot about how serotonin, 90% of your serotonin is found in your gut, but actually 70% of your immune system is also located in the gut. So the microbiome has a significant impact on the development and the maturation. So Christina talked a lot about your microbiome develops, at that infancy. So really your immune system also develops at that infancy. And those microbial, as they colonize in the gut, they help shape the immune system's response to different pathogens, and it helps to promote the development of those immune cells in tissue. So the microbiome interacts with those immune cells to help regulate their activation and their function. So if you don't have, those microbes in your gut to tell your immune cells to kick on, you're not going to be able to fight infection the same way somebody with a healthy symbiotic gut microbiome might be able to. And we talked a lot about the gut barrier. So as we mentioned, that microbiome really contributes to maintaining the integrity of that gut barrier, which acts as a physical and biochemical barrier against pathogens. So Christina mentioned that, a leakier gut or a more permeable gut can allow those pathogens from transferring through the gut lining into the bloodstream, which can lead to, chronic low-grade inflammation. And when you just have when you're in a constant state of inflammation, it's going to be really challenging for your body to fight off any infection or pathogens that may be trying to attack.
Great. Yeah, thank you. I think people kind of overlook that and then don't really realize that the gut plays a big role in a lot of important functions for how your whole body really feels from day to day and long term. So it's hopefully some people are kind of thinking, oh goodness, maybe I should take care of my gut a little more now.
Absolutely. And I know I talked a little bit about my anxiety in college, but I was also sick a lot in college because I wasn't taking such a great care of my microbiome, and therefore my immune system was weakened. So it really is so intertwined that really getting our gut health and our gut microbiome in a good spot is really going to lead to that overall improvement of that quality of life.
So as we kind of wrap up, I am always going to ask my guests what their don't miss this moment is. So if each of you could tell me what your don't miss this moment is that you'd want our listeners to kind of take away or learn about the gut or remember, what would your don't miss this moment be? And I know I'm putting you on the spot, so you can take a moment.
I can start. I think I would kind of piggyback off of what I just said, is that really a lot of diseases and issues stem from our gut health. And if our gut is not in a good spot, it's going to lead to many chronic conditions, metabolic diseases, inflammatory conditions. A lot of autoimmune conditions there's research coming out that those might be stemming from the gut. Your mental health. right? Like, I feel like above all, people are really talking a lot about mental health these days and anxiety and depression and how closely intertwined that gut-brain axis is. I feel like if you're healthy and you're happy, that's all you can ask for in life. And that really does stem from the gut.
Not to shamelessly plug Pendulum, but I have to be honest, I'm a clinician first, and I was really excited to work for this company because of the innovation and what we're doing, and the new strains that we've brought to market. I think a lot of people don't know that it's been over 50 years since a new strain has been brought to the probiotic landscape. And so I would encourage people to research our strains. A lot of functional medicine providers have been talking about Akkermansia for a really long time, and trying to find ways to naturally boost Akkermansia, which you really cannot do if you're missing it completely. So I just think this is a unique moment where we finally have the tools to really correct some things that have gone awry in people's microbiomes, like their gut lining and their gut integrity, which, as Jen mentioned, and I'm hearing from so many different types of providers every day, all day, where Akkermansia is making a difference for their patients in all types of health conditions. So Akkermansia really is having a moment, but we have some other strains as well that are not unique to us, but that are really incredibly beneficial. So I would encourage people to research them and see if they're a right fit.
And I will definitely put a link to them in the show notes as well. Well, good. Thank you so much, both Jen and Christina, both of you guys, for taking time today and being with us and taking a moment to talk about the gut and the microbiome and metabolic disease and maybe some things that people can look for or kind of take pause and think about. I really appreciate it. Thanks for being on.
Yeah. Thank you so much for having.
Yeah, thanks for having us.
Pendulum has probiotics that will help heal your gut. Their lineup includes Akkermansia, Metabolic Daily, and one called Glucose Control, which is great for anyone wanting to improve their blood sugar levels, and you don't have to be a diabetic to take it. Any of these 3 probiotics include an important strain of probiotic called Akkermansia, which is only sold by Pendulum and is a key component of strengthening your gut lining and gut health. All of their products are clinically studied and third-party tested for quality. Check out all of their products at pendulumlife.com/discount/forgiven or click the link in the show notes. Use code FORGIVEN for 20% off your first month membership. If you want to continue learning and hearing all things nutrition for your mind, body, and spirit, click like, subscribe, or favorite me on whatever podcast platform you use. Or you can find me at forgivennutritionist.com. This podcast was designed to educate, inspire, and empower you to achieve your health and wellness goals with your current healthcare provider. It is not meant to diagnose or treat any illness or medical condition or take the place of any treatments from your current healthcare providers.